Hi, my name's Prakash Jayabalan. I'm a sports medicine fellow at the Rehabilitation Institute of Chicago, in Chicago. I'm a physician scientist, so I do a lot of research in patients with knee osteoarthritis. Also interested in how we can use golf to help our patients with knee osteoarthritis as an activity exercise for our patients to try and improve both their symptoms and also their overall quality of life in patients with knee osteoarthritis.
I'm Sam Chu. I'm a physician from the Rehabilitation Institute of Chicago, and I'm trained as a physical medicine and rehabilitation physician or a physiatrist, and specializing in sports medicine. And I'm also here to explore a little bit more about how medicine is practiced here in the UK, as well as potential health benefits of golf, particularly within the musculoskeletal system.
We've had a connection with the Rehab Institute of Chicago for some time with Dr. Joel Press, and he's been over to the UK, and I've visited him in the States, and he runs a very tight ship there in Chicago. So we want the brightest people involved, and that's why we've invited some of his fellows to come over to the UK to learn about some of the stuff we do here.
I mean, we're looking for ways that we can potentially collaborate with some of the physicians and researchers here, and to see if there's areas that we can work on together to explore the health benefits of golf and see what we can do in the US to kind of further this effort that's been going on.
So the purpose of the trip was several-fold. One was really to understand the coverage of a golf tournament in terms of the medical side. We're learning from Dr. Roger Hawkes how he organizes his team to cover such a huge event. And also we want to see about how the medicine can be beneficial from the golf side. So how does golf really benefit the health of an everyday person? And so we're learning from the research side into what sort of research is ongoing in golf.
One of the big aspects of the project is that it is international, and we have universities in Chicago, we have universities in Vancouver, South Carolina, as well as work going on in the Far East, which will aim to highlight golf and health.
In the United States, there's a big problem with obesity and getting people active. So if we were able to show that golf as a whole, which we believe golf is very beneficial to people's physical activity, but if we can provide evidence for that through the World Golf Foundation or through some of the work that Dr. Hawkes' team is doing, that could be hugely beneficial to many of the people in the United States who are interested in golf but never really think of it as a healthy pursuit. And that's really what we want to do by being here, is learn some of those interventions and how they can help our patients.
Well, I think it'll help us a lot in terms of recommendations we can give to our patients and practical ways that we can encourage them to be active day to day and through golf as one means. But I think, as Prakash mentioned, more of a global public health type of effort. It'd be great to have recommendations that we can kind of put forth, or at least evidence to support kind of policies or things going forward. So.